Morning.
Good morning.
How are you doing?
I'm doing good. How about yourself?
I'm good. Where are you in the world?
I am in York, Pennsylvania,
Oh,
which
okay.
is just about 14, 15 miles north of Maryland.
Yeah. Yeah, I lived in Maryland for a while, but my husband's from Philadelphia, so we would go back
Okay,
and forth. Or we were in Virginia for a long time.
right.
So
Where
definitely.
where in Maryland did you live?
So we were in Solomon's Island. We were south.
Okay, that's down closer to my sister Molly.
Yeah, she's in Lusby? Okay.
Prince Frederick.
Prince Frederick. Okay, so
Yeah,
just north of that. Yeah, I used to actually work in Prince Frederick for, well, I guess it wasn't all the way up in Prince Frederick. I can't remember now.
I know she works at Calvert County Memorial Hospital, I think it is.
Yeah,
But I think she only does PRN or per diem or whatever, just enough to maintain her license and um but she was doing wound care nursing
yeah,
before she did fit me.
yeah. It's a fun,
Yeah, and wound care nursing is kind of what got her ticking on the nutrition aspect because she was like, I think she told me that I think she had lots of other different um, categories, if you will, of patients or clients, whichever way she puts it. Um, and but I know that she said that she was seeing quite a few women in their 50s or maybe a little older with autoimmune diseases that were causing them to not heal. And I was like, and that's partly why, I was kind of on my own journey with getting healthy, and I had had a really bad asthma exacerbation a year ago in October that lasted 3 months. Yeah. And I couldn't figure out why it was lasting so long. My doctor kept saying, well, when you have asthma, it takes longer to get better. I'm like, that's not really helpful. And I mean, granted, he did get a chest x-ray for me once or twice, and both times it was negative for pneumonia. But I was struggling. I was just well enough to not go in the hospital, and I didn't really want the hospital bills, and nor the honestly, I wouldn't have gotten any less sleep if I'd gone in the hospital. I might have gotten a little bit more sleep. Who knows? And I know that that's saying a lot because
yeah,
the duoneb, basically my regular doctor who was content to tell me, oh, when you have asthma, it takes longer to get better. He did tell me to go ahead and take the duoneb every 4 hours instead of every 6. And I would just not bother with the plain albuterol because it was just not helping.
yeah,
But I was getting like 1 or 2 hours of sleep each time, like in between each treatment, because the neb treatments were not holding me the whole time. They would give me like maybe 1 or 2 hours of relief. And it's just awful. But enough about me. People are joining, so I don't want to hog up the
no,
conversation.
you're fine.
But yeah, it was really rough. And I was really worried that I had some kind of underlying cancer
Yeah,
because I was like, I knew that when my dad was sick 17 years ago, that maybe if they would have tested him sooner, they would have found his stomach cancer because his immune system, he had gout that January, and it turned into cellulitis. And I said, Dad, did they check your sugar? And he said, yeah, and the ER said it was fine. And so I was like, okay, well then it's not obese. Some peripheral vascular disease from smoking, but it wasn't enough to, yeah, I mean, he did heal.
Yeah.
With antibiotics, so it wasn't that. So in hindsight, 9 months later, he was diagnosed with stage 4 stomach cancer, and he died 3 months later. And so so having that in the back of my mind, I'm like, all right, what's lurking in my body that I can't find, that they can't find? I went and got my mammogram to make sure it wasn't there. Then after, with all the prednisone that I had to take during that first couple months, I ended up with acute gastritis. And so I ended up getting a upper GI endoscopy. And then in February of last year, I got my first colonoscopy, since I was had a history of colon cancer in our family. So it was just really, but nothing showed up. So I was like, okay.
Well, hopefully you're making some good gains here with Fit Me.
Yes. Yep.
Hey guys.
Good
Hey,
morning.
Chris.
I was trying to connect from my computer and it was just like not letting me connect. So I wonder if anybody else is having that problem too.
Ah.
I ended up having to do it from my phone.
Right.
Which is,
I didn't bother with my computer. I'm just doing my phone up in my bedroom.
Oh, I'm on my computer.
yeah, I
Right.
don't know. I was coming straight in from Zoom too, which is normally it works. So I have no idea. But we'll give everybody a minute and then I'll just turn it over to you, Sandy.
Sure. Yeah, I had like one or two back things I mean, I can talk about whatever people want to talk about. I don't really have like a distinct plan. I wanted to do one back thing. I've got all the toys just in case. And the back needs a 2x4 or a big book and the hand towel.
Okay.
So these are actually, a lot of people are catching the replays of Self-Care Sundays.
Okay.
So that's kind of nice because people are using this stuff even after, if they can't make it Sunday morning.
Yeah, no, I have done the same. So I can yammer on about anything. So.
Well, what we'll do is, so guys, and especially if you're catching the replay of this, you guys know Sandy. She is a part of our Fit Me family. She's one of our peeps, but you may or may not know that she is a physical therapist extraordinaire. And not only that, she won't say it, so I will say it for her. She might have said it, but she has a foot program that launches tomorrow. And so if you guys know anyone, or if you struggle with, I don't know, Sandy, what are the pains that would make someone need to have that program?
I mean, anything from plantar fasciitis to Achilles pain to if you get that yearly pain every time you transition into your flip-flops. Flip-flops are not bad. Everybody thinks flip-flops are bad, but any type of foot pain, toe pain, pain when you're running, any of that. Ankle pain, I've got unstable ankles. So it's not necessarily even pain, you just have what you perceive to be weak ankles would be great. Anybody that's married to their orthotics because they were told they have flat feet and flat feet are bad. Flat feet are not bad. And flat feet people have a complex, I think, developed because of that. So any of those people.
Yeah, so if you guys watch this later and you're one of those people, reach out to Sandy about the foot program. Launches tomorrow, and if you know somebody in your life who has those issues, forward it to them so that they can get access to it.
Christy, does it matter if they're a member of the Fit Me coaching or community?
Oh, Sandy, no, this is Sandy's thing outside of Fit Me. This is Sandy's for these programs to help people virtually. And so, yeah, or to anybody.
Got it.
All right.
And same with the self-care Sunday, so that's what I was wondering.
Oh, the self-care Sunday you can forward to anybody, and self-care Sundays you can invite people who aren't in Fit Me. These are open, but Sandy's foot program is not a part of Fit Me. It's her own awesomeness.
Right, okay.
So with that, Sandy, why don't you take over, and have to go to work at some point, but you take over, and if you're mute out, not talking, because I'll do the same, but I don't have since my computer wasn't working, I can't do it for people.
That's fine. Okay. So I won't go into a huge amount of discussion, or, I mean, if you guys have questions, please ask them. But we're gonna talk back pain. Back pain is what's getting people all the time. And I talked about a little bit, and I know that I think Tori did some as well. I don't know, there's so many of these, I'm trying to remember where they all came from. But this is my favorite, one of my favorite exercises. And it is for everybody. It's not like designed particularly for a certain, like if you have back pain or not. It's a good reset. I'll give a small description. So your brain connects to the rest of your body like the soundboard at a concert, right? Like there's the guy at a concert turning all the dials, turning all of the things, getting all the sound ready. Well, your brain does that exact same thing with your body. With every movement, with everything that you do, there are certain things, there are certain dials that need to be on, and there's certain dials that need to be off. And when you go into that movement, if that soundboard, your brain, is not connected right to the rest of your body, then it's gonna either stop your movement or make that movement not as smooth as it should be. So this little exercise that I'm gonna go through is to help kind of recalibrate that soundboard. So this is my favorite to do first thing in the morning, like your feet touch the ground, go to the bathroom, grab your 2x4, like in that order. And I'm gonna show you what this is and what this looks like. So you should have a rolled up towel, hand towel, and a 2x4 or a thick book. It doesn't have to be an exact 2x4. So if you take that towel, so I'm gonna stand up and move on over here so you guys can see. So I'm gonna take that 2x4. You see me? Yeah. I'm gonna take that 2x4 and I'm gonna put it on the ground. Let me move this down a little bit. Okay. So this is to recalibrate everything. So you're gonna take that towel, you're gonna put it right between your knees. So you can use a towel or you can use a small pillow. So you know what that looks like down there. So I'm gonna show you what it's gonna look like up here. So I'm gonna put this towel between my knees, and then I'm gonna put my toes up on top of this board. So this between my knees and my toes up on top of this board. Okay, it's gonna look strange and it's gonna feel strange. Apparently I can't get my whole computer to see my whole body. So with that, between your knees, toes up on that board. Then what you're gonna do is you're gonna reach really tall. And I'm gonna go from the front. You're gonna reach real tall, and then you're gonna squeeze this towel between your knees. Does that make sense? It's gonna feel and look a little strange, and that's okay. So again, I'm gonna repeat everything I've done. I have a 2x4. My toes are on a 2x4. I have a towel or a pillow between my knees. And I'm gonna stand up real tall. Then I'm going to squeeze this pillow or towel between my knees, and I'm going to reach for my toes. And you're going to hold that for about 2 to 3 seconds. So reach real tall, squeeze between your knees, reach, reach, reach for your toes. Now, if you can't get to your toes, it's totally okay. So we're going to repeat that 5 times. So you can follow me if you want, or follow me later. Towel between my knees, toes up on the board, standing real tall, squeezing the towel between my knees, reaching for my toes. You can have a slight bend in your knee. I don't necessarily want them locked out. A slight bend in your knees and reach for that. Repeating 5 times. Reach, 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 squeeze. Reach for your toes. 1, 1,000, 2, 1,000. Relax, squeeze again. And repeat that 3 more times. Reach, 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 squeeze. So for me, every time I reach, I keep going further and further and further. And it's not because I'm stretching out my hamstrings, because I'm reorganizing that little soundboard of my brain connecting to the rest of my body. Do it one more time. I forget, I lost count. So that is the first thing.
Sandy, I have a question.
Yeah.
When you have your feet on or your toes on the block, how much of the ball of your foot is on there, or how much is it just toes?
It is like the balls of my feet.
Okay. Thank you.
Yeah. And then you want to bring your feet as close as you can together. But obviously you have something between your knees, so they're not going to be like, I guess if you have a real tiny thing. So this little movement has single-handedly created less pain in tons of people that I have treated. And just doing that one thing, first thing in the morning. And what it does, like I say, yeah, do you want to try it? Yep, so stand up nice and tall. Kristen, yeah, but you don't come up on your heels. Don't come off your heels stay on the ground.
Okay.
Squeeze that towel between your knees. And now bend forward to touch your toes. Yeah. It's a good one.
Yeah, it is. I feel it in my calf, in the back of my ankles.
It's a good, and I'll explain a little bit of what happens. So we always think our hamstrings are tight. Everybody has tight hamstrings. And I would say that's probably not the case for maybe half of the people, that those hamstrings are overactive because of either an underactive or and this might be going too far, overactive or underactive adductors. Adductors are the muscles on the inside. These are your adductors. So if these are overactive and these are overactive, your pelvis can't function. And then it hurts or it feels weird to bend down and pick something up off the floor or something like that. So this is called a toe up progression. Now, a lot of people will do this toes up first, and then they'll spin around and do their heels up. The same thing, 5 times, like a 2 to 3 second hold each time. Toes up on one side, do that 5 times, then turn around and do your heels up, and then do that 5 times. That's my challenge to everybody that watches this later, is definitely try this. It looks weird and it sounds weird, but it is like single-handedly up there with my top 10 favorite things to have people do.
I wanted to try it, but Georgia woke up right as we were starting, so I've got to.
Okay.
And then she wouldn't let me put her down, so I'm going to try it in a minute.
Sandy,
Yeah.
can I ask a quick question?
Absolutely.
My knees hyperextend all the time, so when I do that, should I make sure that they're slightly bent? I mean, like tiny bent. because, okay.
Yep. Exactly. So when you hyperextend your knees, that adds a different element to that soundboard, because then we have a different way that those hamstrings activate and function, because your hamstrings attach to your pelvis. Your hamstrings attach right here to the bottom of your pelvis. So if you are hyperextending your knees, then those hamstrings are taking on a different role than they're used to. You may, yeah, perfect. Kristen, how's that feeling?
It's good. I was just trying to, I think my legs are a little longer, so I was having a difficult time telling when you said put the towel between your knees.
Yeah.
Like right where the knee bone, the bony part is?
Yep, or
Okay.
just above it.
Okay, just above it. Okay.
Yep.
Yeah, my hips
Something
come
for you
all
to
the way up.
squeeze.
Huh?
Just so that there's something for you to squeeze.
Okay, got it.
Awesome. So I'll let you
And
run
then
through that one more time.
when you go down, do you try to keep your back flat? Or
Just
is it
let
okay
your
to roll your spine a little bit?
Let your back do what it kind of wants to do. There's no, I don't want you to focus on trying to keep it, I'm trying to keep it straight.
Right. I mean, I do feel that in my hand, in the back of my
And you
leg.
might, and that's totally normal. Everybody's gonna kind of feel it in a different spot because everybody's wired a little bit different.
Right.
So this is like one of those things that people get instantaneous response in a positive way, meaning some people will bend forward and they can't touch their toes, and they'll run through one cycle of this, and if it's a matter of what we're trying to fix, it'll improve instantly. And it's really fun. It's a fun party trick.
One more question, and it just left me. Oh, I know. How long should I forget how long you said we should hold each time when we're
2
going
to
up?
3 seconds. Nothing crazy. 2 to 3 seconds.
Okay.
And it just opens up the back a little bit, allows your hips to move a little freer.
Right.
And overall, it just feels good.
I didn't plan ahead like I was supposed to.
Correct.
So
Perfect.
I grabbed this book.
Perfect.
I haven't used it yet.
Well, now it's serving to help your back.
Exactly. So I want to use it, but my mom gave it to me for my birthday 5 months ago, and
Yeah.
but yeah, and then I'm using my yoga mat to help me keep the book clean.
Well, there you go.
I'm not putting my toes on it.
Nay.
There she is. We're happy.
Oh. Hello, Georgia.
She's like, buddy.
Hi, sweet girl.
She's like, my back feels awesome.
I bet it does.
Oh, that's funny.
Oh my goodness.
Okay, so I'll let you guys choose. I can either do another stretch for the back. One thing I like to do is I have a little rescue, like if your back hits the fan, the 3 things that everybody should do immediately. I can do that.
Okay.
There are aches and pains. I know we've got some knee people on here. If we want to do knees, is there anything you guys want to talk about?
Mom, tell her, how's your pain that you were talking to me about the other day? I wonder if shit.
Yeah, no, I'm here. I was overdoing my little stretching thing. Which one, the piriformis?
Yeah, your like lower back glute pain.
Yeah, I don't know if it's piriformis or sciatica, but it's like there all the time, almost all the time. And I try a lot of stretches, but it's bad.
One of the reasons that people will have that sciatic type pain is because they have a rotation of their pelvis. So let's do that, because the things that I would do for the low back are the exact same things I'm going to tell you to do for that type of pain also.
Okay, and Sandy, am I coming through? Can you hear me?
Yeah, absolutely.
Everything basically is hyperextendable in my, I'm like one of those crazy loose ligamented crazy people. So it's a real problem.
Yeah, so those types of people, you rely a lot on your ligaments sometimes instead of your muscles to give you support. And so when that happens, because ligaments are really tight and ligaments connect bone to bone, tendons connect muscle to bone. So when you are relying on ligaments for some of your stability and they attach bone to bone, then it's easier for you to kind of manipulate those bones out of position, and that hurts like hell. So, and if it's that radiating sciatic pain, now it could be disc and it could be coming from your back and all of that, but when people specifically say piriformis pain, the piriformis pain to me is like here.
Yep.
Or here.
Yep, and maybe slightly a little, just maybe like a half an inch or so out to the side a little bit more. Yep, right there.
Exactly. Okay, so let's go through 3 things to help with that. So first off, we want to go through a small adjustment of your pelvis. Now I can't tell if you have a rotation, so we're going to just address both sides of that rotation. So and ask questions if you have it. I'm just going to kind of plow through this because I want you to have the information. You can go back and watch it later. So laying on your back, you're going to first start. So you can do this first thing in the morning. Can you guys still hear me? I'm far away from my computer.
Yep, you're good, Sandy.
Okay.
Yeah.
So you're going to bring up one knee. So with the leg that's down, I am going to lift my bum a little bit off the ground to activate the hamstring on this left side. At the same time, put your hand against your knee and resist your knee from going up. You're going to hold that 10 seconds. You're going to do that 3 times. So I'm going to show you again. One foot down, one knee up, activating your hamstring by slightly lifting your bum off the ground and pushing into your hand. So my knee is going up, like I'm resisting my knee from going up. Again, 10 seconds, 3 times. Then I'm going to have you do the same thing on the other. After you've done the 3 times through. 10 seconds. Relax. Again. 2, 3, 4, 5, 6, 7, 8, 9, 10. So again, 3 times on each side with a 10-second hold. Then, with both your feet flat on the floor, you're going to open your knees as wide as you can, and then bring them back together and squeeze them together as physically hard as you possibly can. You can also put something in that space. To be honest, a yoga block is better, but something to squeeze. So you squeeze your knees together as hard as you can. So that's kind of the first thing. The second thing is then a piriformis stretch. Now this is one that I see done incorrectly, not incorrectly, but a stretch that usually people will bring one leg up and then they'll weave their arms through to grab onto that other knee. I want you to do it a little different. So you're going to cross one ankle over one knee. And then you're going to grab the ankle and you're going to pull it down towards the opposite hip. I feel like I'm on a lazy Susan, like rotating. I just want to make sure you see what I'm doing. Then you're going to grab the back of that knee and you're going to pull it across your body towards your opposite shoulder. Now I'm super tight, they lifted. But that is what I want you to go for. So I'm coming kind of slightly across my body. So again, grab the top of your ankle Pull that ankle down towards the outside of your hip. Other hand, Christy, if you can. And grab the back of your knee and pull it towards you.
Like this?
Kristen, grab the top, switch your arms. There you go. And bring that knee towards you. There we go.
Oh yeah, I feel it.
Christy, grab the top of your ankle with your right hand and pull it down towards the outside of that same hip. But don't push your knee away. Push your knee towards you. Yeah, like you're bringing that whole thing towards you. You should feel a stretch deep in your bum.
Yeah. Oh yeah. Am I doing it right?
Yep.
Okay.
So, I like to switch it to see if we don't have other stuff. Again, crossing your ankle over your knee, grabbing that ankle, pulling it down, grabbing the back of your knee and pulling it towards you. Should feel a stretch somewhere in your butt. So you need to hold this for at least 60 seconds, 3 times on each side.
Sandy, I get it really good on the right side, but the left side, I can't bring my ankle down low enough to get the butt stretch. But that's just because I'm.
But then that obviously highlights an asymmetry, and that's okay. Just do the one that you feel is stretch.
But I did get a pop in my
My
pubic symphysis, yeah, when I was doing another thing.
It's always scary at first, and then it feels good.
Well, I knew it was coming because I could feel the shearing when I was doing the leg bridge thing. So
yeah. So those are my favorite kind of 2 or 3 things for if you have. Hi, Georgia. See, I don't know how you get anything accomplished.
She's really funny. You did good.
Is Josh home?
He's not home yet. He's on his way.
Oh wow.
Yep. En route.
Awesome. I'm thinking and praying for you guys a ton.
Thanks. It'll probably be tomorrow night or Tuesday morning.
Okay.
Oh boy.
Yeah.
How's that feeling, Kristen?
It's feeling really good.
Okay. May, were you able to try?
Yeah, I did it. Doing it. It's early here. That's why I look so scary.
I'm in the same time zone.
I don't think I can get a good angle of it with this one.
Yeah.
All right. Do you pull the knee straight back or do you angle it?
You angle it.
Okay. All right. That one I can get a super good stretch. I can bend that knee. The other leg, because I can't bend my knee like even to 90 degrees.
That's okay. You had a knee replacement, right?
No, I haven't yet. That's the problem.
Okay.
So the knee should be like angled towards my knee should angle towards the left shoulder.
Correct.
Is that correct?
Correct.
Okay.
And you should, even if you can't completely bend that knee, that's okay, as long as you get a stretch in your bum.
Yeah, and the other one definitely I can, because I can bring that all the way over.
Yeah, so if you run that, so if you did, for you specifically, if you wake up in the morning and you do that, the push down and the push against your knee on either side, 3 times, 10 seconds on both sides, then do the piriformis stretch, which we just went through, then do the 2x4 thing when you first stand up. I would be shocked if that didn't improve anything.
Okay.
Yeah.
Mom, did you understand the one that she was showing you, the bridge one with like
Yeah,
each side?
Yeah, I didn't have the video on then. I'm going to go back and watch it again later. but and you had the one where you open your knees up like as far as you can. See, that's one of my crazy things. When I do that, I literally can put them down almost to the floor. You get to
So
see my
that's
face.
actually, that's just prepping for the
Squeeze.
prepping
Okay.
to attempt to adjust the pubic symphysis if it needs to be adjusted.
Ta-da! I'm upside down.
Okay, so does anybody have any other things? That was actually the things that I wanted to cover. They all addressed very similar things, so it was perfect.
Yeah, I love like having 2 or 3 like memorable takeaways. Those are really good ones. I can remember it.
Those, like, unless there is some crazy disc bulge where you shouldn't bend forward, these are some of my like bread and butter go-to things for people with hip, sciatic, SI, low back things.
So, Sandy,
Yes,
I just got me one of these things. Can you see it?
I can. Like
So-
the modern version of the Sally Summers.
Yeah.
Those are great. Those are great.
So when the exercise that you said, spread your legs and keep your feet together and spread your legs out so that you, as far as you can touch, then when I bring them back together, I figured this would be something I could squeeze against.
Yep, but you want your knees a little closer together. So bring your knees up. So bring your feet on the, yep, and then bring that a little closer to your knee. There you go. Yeah, because we want that. I want your knees like at least over your hips, if that makes sense. Yeah, but those are fun. A lot of people either have tight or underactive adductors on the insides of those legs.
Well, I don't know which way it is, but I just know that I feel tight in my hips. I just started doing a challenge for myself to stretches for splits. And because even when I was a kid, I don't think I ever reached the floor with my crotch.
Everybody is kind of made a little differently, so it actually depends a lot on the positioning of how your hips are organized, because there's a lot of variation of how the hip goes in the socket. So good job for you. You're taking on some of those things. That's awesome.
So Sandy, sorry, Kristen, go ahead.
Oh, I was just wondering, the position of my feet.
They should be on the floor. After you like open, put them back on the floor.
Are my feet flat on the floor?
Yes.
So like.
Yep.
Okay. I was putting them on the side and I wasn't sure.
Yeah. I mean, when you open your legs, you can let them roll off to their sides. But when you bring your knees back up, I want those feet on the floor.
I don't know if you can see.
Yep, that's perfect.
Okay.
So Sandy, if people watch this later, how can they get in touch with you? Either to ask questions about this stuff or about your foot program?
Yes. So I can be found in a couple of different places. First, email so I'm Sandi, SANDI, at telutelu.com is email. I'm on Instagram. That's a quick way because I kind of check that frequently. So I'm Dr. Sandi B. I'm just Dr. Sandi B. On Instagram. And those are probably the 2 easiest ways at this very moment. What I can also do is post that because the evolution of today will produce better outlets for me to be accessed through my website once it's created and done. So I can post that also later with Or I can
Perfect.
give,
Yeah, once it's done, we'll just put it, because this will go on like a YouTube playlist, and so that way that can be underneath it. But if, I know some people with back pain are going to catch this replay because they specifically wanted this info. So
Yeah.
just wanted them to be able to reach out, because some of the people with back pain also have the foot pain. And so I think they're your people.
they're very related.
Mhm.
I have one more quick question.
Yeah,
Um,
May, go ahead.
When I was doing that, the stretch for the piriformis with my knee crossed over and my hand, the small of the back should be flat on the floor.
The small of the back will
Or not the small,
probably-
but yeah, just, I was
don't
lifting up.
I don't want you to roll.
Okay, that's
So
what
like
I,
the back, like if you are laying on your back,
yeah,
it should stay on the ground. I don't want
Okay.
you to roll with it.
all right.
Good question.
Sandy, you're the best. Thank you so much.
Yeah, thank you. Thank you. And have a happy bye, Georgia May.
Oh,
See, my piriformis is awesome.
Georgia, can you blow kiss? Georgia, kiss.
Mwah. Blow kiss.
She
Blow
does the
kisses.
funniest. Georgia.
Mm. Nana's blowing kiss at you. Can you blow kiss? She's like, no, I
Oh.
cannot. Look at that
Sorry.
face.
she's like, there's another stranger on there.
She's like, I'm the boss of me.
Oh,
All right, you guys, thank you so much.
yeah.
All
Thank
right,
you.
thank you.
Bye, guys. Thanks,
Bye,
Sandy.
guys. Yeah, my
Yeah.
pleasure.